Today I'm going to be doing a sterile dressing change for a CVAD. First thing I'm going to do is check my physician's orders, ensure my patient's 6 medication right, gather all my supplies, head into the patient's room. I'm going to introduce myself, identify my patient, and then explain the procedure. After I've done that, I'm going to put on a mask for myself and then provide a mask for my patient and have them turn their head to the side, away from the dressing area. Then I'm going to perform hand hygiene, and I'm going to put on my gloves. And then I'm going to come over and begin removing the dressing. I'm going to be gentle and make sure not to touch the line site. I'm going to remove from outside in. After I've done that, I'm going to remove my gloves, and I'm going to come over and open my kit. And then get my sterile gloves out. Come over here to this end of the table so I have plenty of room. Open my gloves. Following sterile technique. I'm going to begin donning my sterile gloves, avoiding any contact with my sterile field, or with an unsterile field. Okay, when I've done that, I'm just going to move that out of my way. And then I'm going to get my sterile field ready over here. I'm going to lay it down, shiny side down. And then I'm going to take my supplies and drop them on the field. And I'm going to come over here and begin cleaning the area. So I'm going to take my swab out and my tweezers here, and I'm going to lift my line, and I'm going to clean in a circular motion around the whole site. And I'm going to take my chlorhexidine, activate it, and scrub the area around, and scrub up the line all the way to the end. And then I would normally lay that down and back down into the clean area, but because he's standing I can't, so I'm just going to let that down. I'm going to come over here and I'm going to get my bio patch. And once this is dry, I'm going to attach my bio patch. And then I'm going to come over here and get my skin protectant and rub it on where the dressing will be sitting. And then I'm going to grab my dressing, open it up, and apply it over the site. with the site in the middle of the dressing. I'm going to remove the edges and push down, make sure they all close up. Then I'm going to put the time, date, my initials, and the needle's gauge size on my dressing. And then after that, I'm going to go in here and change my connectors. So I'm going to remove, make sure this is clamped. I'm going to remove my connector. I'm going to scrub the hub for 15 seconds. Then I'm going to take my already primed saline lock and clave and attach. And then I'm going to unclamp, aspirate, then I'm going to flush, and while I'm flushing, I'm going to lock my line and provide positive pressure. I'm going to remove my saline lock and tape this up here in a more comfortable position for the patient. Then I'm going to go ahead and clean up my mess and document according to facility policy.